Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. Every week on this program, I have a different guest where we talk about different services and programs offered here at KRMC. So I hope you'll stay tuned because we'll be back right after these messages with another great guest. Welcome back to Your Health Matters. My guest today is Leana Asplin, who's the Manager of Volunteer Services here at KRMC. Thanks for being on the show, Leana.
Thanks for having me.
Volunteer Services, I think you have the biggest department at KRMC, right?
I do.
So where are we at now, almost 300?
Yeah, we're just shy of 300 volunteers, about 170 adult volunteers. Wow. I'll be orienting new volunteers, our summer youth program here, and that'll bring us up to about 60 youth volunteers, our volunteers. We have chaplains, spiritual leaders, we have hospice volunteers, and we also have job shadow students.
Oh, great. So all of that kind of falls under your bailiwick.
It does, it does. That's my gang.
And the important thing, I think, for people to appreciate about our volunteers is, as we call them, volunteers, but I mean, they're basically unpaid employees, right?
They really are. Yeah, they're unpaid staff here at the hospital. Their paycheck obviously is often deeper than the financial rewards because they get their rewards through doing their kind deeds. Or some of them get that credit for schools that they need. It's great on job applications, scholarship applications, those kind of things. So sometimes their rewards are a little deeper than a paycheck.
Very good. So volunteers, let's start with them because they're the youngest and we'll work our way up.
All right.
So our volunteers, what's the youngest age someone can be a volunteer?
They have to be at least 14 years old and at least registered for their freshman year of high school.
Okay, so basically high school.
High school students up to age 19.
Okay, and then they become an adult volunteer after
that?
Okay.
They do, yeah.
So now the volunteers, I know you kind of run them through a program twice a year to get them oriented. Yeah. So
I do a summer program and a fall program. So we're getting ready for our volunteer orientation for our summer program. Where that orientation is next week, and we'll be orienting about 35 new students.
Wonderful, that's awesome. And so how many hours do they volunteer as a volunteer?
I do ask for a minimum 40-hour commitment. Often that takes them the entire summer because they have extracurricular activities, vacations,
family
those
time.
kind of, yes, exactly. But a lot of them stay for a long period of time. The Academy does require 80 hours of volunteer services within the community towards graduation.
Okay.
So a lot of the kids do stay for, at least that minimum 80 hours, but I've had some that have stayed for up to 1,000 hours of service.
Wow, that's great. And like you said, it looks great on both an application for school, as well as resumes once they graduate and they move on.
And scholarship applications as well.
Well, and we can talk about that since you brought that up because I know that's it's a source of pride for our volunteers, all of the scholarships that they give.
Yes, it is.
Let's talk about that.
Our volunteer program is a fundraising program. We do, excuse me, we raise quite a bit of money in our wonderful little gift shop. I also invite 6 vendors a year to come into our facility and put on vendor shows. At those shows, I take 20% of their profits for allowing them to come and play with us. The other thing is I take 20% of the profits from our vending machines as well. So I'm always all through campuses, yes. So I'm always looking for opportunities to make a little more money. And what we do with that money is 2 things. The first thing is for college students pursuing careers in healthcare. We sponsor many, many scholarships a year. And the other thing is we do buy equipment for the departments. Must be capital equipment of $5,000 or more.
Wow.
And our volunteer group is very, very focused on what is necessary to provide great care to our patients. So very patient focused. This past year, we donated back about $75,000 in scholarships and equipment through our volunteer program.
That's awesome.
Yeah.
That's really amazing. And I know there's some examples of different equipment that the volunteers have paid for.
Oh, goodness,
Like,
yeah.
Up in perinatal, wasn't there some special
We did
baby
some
warmers or something?
isolettes a couple of years ago. I know that there's been a couple requests this year. We've bought pulse oximeters for our emergency department. We bought iPads for the nutrition services department, so when they're meeting with patients on dietary needs. Oh gosh. We're looking at some wheelchairs this year for the emergency room.
Very good.
So it's whatever their need is at the time.
Right, and I know like you help cardiac rehab with some equipment.
With equipment,
and
yes.
so
yes.
it's awesome that they're doing that and able to help the hospital too, especially as we're in a tight financial situation now. Healthcare is
Absolutely.
so the more we can help, the better for the hospital.
Absolutely, and the more we all shop in our gift shop, the more we can
Right, there you
donate back to
go.
the hospital.
Well, and of course, the gift shop is one area that people can volunteer, that we have volunteers in.
We do.
And it's also tax-free in there, right? Isn't
It
that
is,
kind of
it
a
is.
nice little benefit?
Because we're a not-for-profit facility, yes, there is no taxes.
Sales tax,
No
so-
sales tax.
I don't know if our general community knows that, but that's a good thing to know.
It is, it
Whether
is.
you're birthday shopping, Mother's Day, Father's Day, I mean, you have gifts. It's not just for sick patients.
Oh,
I mean,
absolutely
you have
not.
beautiful things in that gift shop,
We do.
jewelry, and in fact, is your necklace in there maybe?
It is,
I thought
it
it
is.
So you're a walking advertisement
Oh,
for the gift
always.
shop.
I spend a good part of my paycheck in that gift shop. Yes.
So let's talk about the regular volunteer program and all the different parts of the hospital where they
right.
volunteer at, because it's not just the gift shop.
It isn't. And we do have what we consider our traditional volunteer positions, which would be the gift shop, would also be our information desks where volunteers provide direction, escorts, discharging and admitting patients via wheelchair, delivering flowers, mail, those kind of things. So those are kind of those traditional areas. But we do have some very non-traditional areas. Our courtesy cart that helps provide transportation for our patients on campus. They also do an awful lot of our daily runs from each of our labs, the lab in the main building to the building at the Medical Professional Center. They deliver pharmaceutical needs to our cancer center. Gosh, they keep running
Back and
constantly.
forth with that courtesy
we
cart.
put a lot of miles on our courtesy cart.
Very good.
And then we're now providing services in the cardiac cath lab. We have a volunteer in the wellness center helping out with our diabetic educator. We have volunteers in human resources. Goodness. Public relations for Jamie Taylor.
Yes.
So we have them everywhere. We have some wonderful teams of volunteers we call our patient advocates that visit with the patients that just need a visitor. But they take around a cart of all kinds of free stuff for them, from hand lotion and chapstick and crossword puzzles to reading glasses, Bibles, whatever their needs are, and they provide those as a free service. We also have a coffee cart that goes up and visits the patients between breakfast and lunch and offers free hot cocoa, hot coffee, hot tea, and a nice ear to listen if they need it. We do have a pet therapy program where we have our dogs that go and visit our patients.
And that's kind of special too, because a lot of times when our patients, they probably have a pet at home that can't come into the hospital, because there's some pretty stringent rules. Maybe that's something else we could talk about with the pet therapy, because it's not like just anybody can walk in off the street with the dog and go, hey, I'll let the patients pet my dog.
No. With pet therapy, there is a program that they do have to become certified through. Both the dog owner and the dog are both certified. They go through quite an extensive training and certification. We also have to make sure that we keep their their vet records on.
So they're up to date on their shots.
Always.
Right.
And the dog has to be washed and cleaned and pretty before they come in to visit the patients. But they also check to make sure that the patient doesn't have any pet allergies before they go into a patient room. So it's a very structured program.
Sure, and I think it's important for people to realize that they go through all of that. So again, it's not just a dog off the street. I
No,
mean,
it's not.
Been cleaned, and don't the pet therapist person, volunteer, have like hand wipes and stuff that
Yes,
they use?
they take hand sanitizer along with them.
Right,
and
so they make sure and they wipe the dog down.
they
after
do,
being
and
petted.
whoever wants to pet the pet will have to wash their hands prior and again afterwards
That's
to keep from passing
Sure, how we
germs
pass
around.
germs, yeah,
Right.
that's a good thing to know.
Right.
So then so that's the pet therapy, and we have some volunteers over at the Cancer Center, right?
do.
That help with.
We do.
They do manicure, not,
They
what's the
did,
word?
hand
Manicures?
massages.
Hand massages.
But the biggest group of our volunteers are providing services to the patients as well as supporting the staff over there. Just providing water. I have one volunteer who started bingo with the patients an afternoon a week. So
At the Cancer Center,
at the
while
Cancer
they're sitting,
Center,
waiting, or
while they're
their
doing
treatment.
yes.
Oh,
yes.
that's kind of fun
So
idea.
she's done a great job over there. So that's a lot of fun.
That can be, a lot of times they have to be there for hours.
For hours.
So that's really nice to have something fun like that. Bingo.
It is.
I'm good. I'm done.
Yes, exactly. So she's got lots of energy, and she's done a great job over there.
Excellent. Excellent. So we've talked about all the different parts of a volunteer can do. How does a person become a volunteer?
It is an application process. It's just like starting a job, like we said earlier.
Okay.
It's just an unpaid staff member for our
Okay.
hospital. So we do ask that they complete an application. Those applications are currently available in the gift shop, and we're working on an online process for that.
Okay.
But they do have to fill that out. They do have to complete a background check.
Okay.
They're TB skin tested and drug screened just like our staff. And once they pass that process, then we're able to assign them to an area. And I do have an extensive interview with them and talk about what their desire is and what they would like to be able to do in a hospital. So I give them the first chance to come up with a plan, and then we try to fill those
Give
needs.
something to that. And I know
Right.
we're always working with department managers, looking at
Right.
different areas of the hospital where they're going to need extra help.
Yeah,
and
I
then
work
try to
with
find
those
out.
department managers to create a service description so that the volunteer's full aware of what their duties will be, as well as the staff understands how they can utilize that volunteer appropriately.
Sure, yeah, and that's a good word, appropriately.
Yes, yes.
We try not to abuse our volunteers or take advantage too much.
No, not too much. Yeah.
But they do provide a wonderful service for our hospital.
They do.
And they're advocates for us too. I think
Oh,
the
very
majority
much.
of them are big pro KRMC employees
They are.
or volunteers, and I know they're out in the community talking about KRMC and what we do here.
They do. A lot of them have been past patients, had great care, and are here to give back.
And some are even past regular employees.
Right.
And they retire,
Yes.
and then they just can't stay away, so they come back here to volunteer.
Yes, we do have a handful of those as well.
That's awesome. And some of the benefits of being a volunteer, because I know we've kind of bumped up because they don't get a paycheck, but we
Right.
try to find other ways to reward them for being a volunteer. What are those?
Exactly. Well, first of all, they get a free meal in the cafeteria each time they work. So that's always kind of fun. And then any of the benefits that the hospital employees get, we try to make sure that they receive. They get the discount at the Wellness Center, just like employees do. Discounts on other services, whether they're become a hospital patient, God forbid.
Okay. Yeah. Well, we'll come back right after this message, and we can talk a little bit more about that. So stay tuned. We'll be back right after this.
But they get 10, 15, 20% discounts on some of the businesses in
That's
town,
great.
which is wonderful that they're acknowledged by the community as
Right.
well.
Welcome back to Your Health Matters. My guest today is Leana Asplin, the Manager of Volunteer Services here at KRMC. Thanks again for being on the show.
Thanks for having me.
We were talking before the break about our volunteers and obviously how much they do for KRMC and for our community, but then we try to give back to them as well. So we're talking about the benefits that we give to our volunteers. So what were they again?
Again, they're a free meal each time they volunteer. They get the same discounts that hospital employees do at our wellness center. As a hospital patient, if they ever become a hospital patient, that they will receive a discount for their service. Let's see. Our audiology department offers our volunteers and staff here at the hospital
a discount on hearing aids.
On hearing aids.
Very good.
We also, there's businesses in the community, if they walk in with their volunteer badge, that they get 10, 15, 20% discounts on some of the businesses in town, which is wonderful that they're acknowledged by the community as well.
Absolutely. And then they get their uniform.
They do get get their shirts as part of their service. We want them to look like volunteers, and certainly not to look like a nurse or a tech here at the hospital. We want them well identified as a volunteer. Right.
And I think it's appropriate, we just recently in our community lost Helen Graves.
We did.
Who started the KRMC volunteer program, right?
She did.
The Pink Ladies,
is that what they used to be called? Back at Mojave General Hospital in 1961. So we're 53 years in existence. Our volunteer program, starting with Helen Graves, who recently passed.
So they were the Pink Ladies because it was just women at that point.
It was a ladies' auxiliary.
Okay, and then how do we go blue?
Well, funny story. We did have a couple of men that were interested in the program, and a couple of them didn't mind wearing those pink smocks or a pink polo shirt. And then as we progressed out of the Pink Lady stage, and we became a volunteer department in the hospital, and we were beginning to recruit more and more men, one happened to be my father. And he was kind of the leading edge of changing us from an auxiliary and Pink Ladies to what he used to call the Blue Dudes, the volunteer program, and we decided to go with the color that everyone loved and felt more comfortable in. So,
very good.
And now volunteers are a part of the hospital. They are a department of the hospital, where in the past they were an incorporated business of their own.
Their own 501c3.
Exactly.
Right.
Exactly.
So now they're actually a department of KMC. And we, as we said at the beginning of the program, we've got men and women and teens and elderly, all ages.
Right. And when I took over the program, I became part-time volunteer manager back in the late 90s, 1996 or 7, I believe. And we had 40 volunteers back in the day. So we've really built a very nice program up to around 300 volunteers, and hope to continue to grow.
Absolutely.
Because there's always more services that we can provide and more support to staff and patients and visitors that we can provide.
Well, and that's one of the reasons I asked you to be on the show. I wanted to talk about the fact that we have those opportunities to let people know, if they're sitting home on the couch and like something to give them motivated to get out once in a while, and we only ask 4 hours a week.
Exactly.
Right? They could obviously do a little more if they felt or they wanted to, but normally it's just a 4-hour stretch.
It is a 4-hour shift a week is a minimum.
Right, and even like over at the Wallapai Mountain campus and the acute rehab, we have volunteers, and I think I know you're very flexible to work, as we talked about, with them, kind of trying to help identify their areas of interest,
right,
and then trying to find a department, a good match that'll work for them. So that's good. So we talked about there's volunteers at the front desk, and we talked about the gift shop, but I know another area we haven't talked about is the blood drives, because that's a really important part of what our volunteers do as well.
It is. And our next blood drive is coming up Wednesday and Thursday, May 28th and 29th.
Okay.
And our volunteers do coordinate those drives. They man the registration booths. They make sure that after you've donated blood, that you make sure you get your goodies before you leave.
You got to wait for a little while, so you're not going to pass out.
Yes. So they're coordinating those drives. They help set up the rooms and put out signs and get the advertising out so that everydy's aware that the drive is coming.
That's great. Yeah, we put the banners up on the street and put it on the sign and let everybody know. And it's becoming we've been doing it obviously for years, but I get calls pretty regularly from people. When's the next blood drive? And So that's good for them to, and every quarter, we do it once
They're
a quarter.
quarterly, yes.
And it's United Blood Services.
United Blood Services is the organization that provides blood
Okay.
to our hospital and the ones that do the
Right,
the
and
donations.
that blood donation obviously is very important and very critical to
It
our
is.
community because, well, first of all, we don't have a blood bank here at KRMC where we store.
No, we do not.
Yeah, so UBS is our supplier of
They
blood.
are.
So they
are.
come and gather it, they keep it, and then they send it to us as we need it, right?
As we need it. And the issue is that they do provide services to all of the what they call the tri-state areas.
Okay,
So it's
yeah.
Needles hospitals, the Lake Havasu and Bullhead City hospitals, as well as Las Vegas.
Oh, wow.
So, and of course Kingman Regional. So they do provide blood to a lot of areas, and often they struggle with having enough blood to
Right.
support all those areas. So it's
Well, and
very
especially
important.
during the summer, I think is a harder time. There's number one, more people are traveling, so more accidents.
Yes.
Needing more blood, but then because people are traveling, they may not always do their regular donation.
Right, right.
They might miss, and that's, I think, good to know that if for some reason they can't come to KRMC, UBS pretty much has a blood drive, I think, going in one of the Tri-City areas
Right.
all the time. I mean,
Right.
they're at the Elks Lodge, they're at a couple
They
of the
are.
churches, so.
And they're welcome to call me. I keep a schedule of all those other blood
Okay.
drives within our areas. So
Oh, good.
at any time, I've got a list or have access to that information.
That's good to know. Which reminds me, we should give them your phone number because not only about the blood drive, but if they're interested in being a volunteer, they
Absolutely.
could call you with some questions. So what's your direct number?
It is 928-692-4673.
4673. Okay, so we'll mention that again before the end of the program. And we did talk about that if they're interested in being a volunteer, there's the application process.
Yes.
And they can pick that up in the gift shop, right?
Yes.
They can just come to the hospital and gift shop. Eventually, we're in the process of redoing our website, so eventually, hopefully, we will have that online as well.
That's on my wish list.
Okay.
Yes.
But for now, they can just come to the gift shop and pick an
Right.
application up.
Or if they want to call me, I can mail an application to
Okay.
them as well.
Okay, and that number again, 692-4673.
4673.
Okay, very good. I'm trying to think if there were some other areas of the volunteer program that we haven't talked about. I want to make sure that we cover all those.
Some of the new areas that I'm working on, I've been working with our imaging center. We now have 5 days of coverage of volunteers over in the imaging center.
Great.
With the mammography group. That's going well.
Or even at Little Minnows, don't we have a volunteer?
We
or two
do
over
have a
there?
volunteer. We have one over there currently with the
Okay.
children. So there's a lot of opportunities. I think one of the things that scare people off from coming to KRMC to volunteer is they think it has to be nursing, that it
Or
has to
they're
be in
gonna be
health.
around, yeah.
Yes, that they'll be around sick patients. But Kingman Regional is kind of a little city of its own.
Yes, it's true.
We offer, from accounting and business office settings to, I have volunteers working with our plant operations department, helping with
Oh.
outside maintenance. Like you said, volunteers in daycare. I had a volunteer in our laundry department.
very good, yeah.
There's a lot of opportunities. The cafeteria is a big one, especially for my volunteers. They love working in the cafeteria, partly because once they turn 16, if they've been a good volunteer, they will hire them. So there's
it's a
another
segue into a job
Absolutely.
at KRMC, and then
Absolutely.
the sky's the limit after
One of the
that.
things that we're working with, hopefully we're going to have a volunteer this summer that'll be working with Victoria who wants to
Oh.
become a baker.
Oh, it's
so
fun.
there's so many opportunities
And what a
besides
great
healthcare.
teacher.
Oh, Victoria's outstanding. So that'll be fun.
Absolutely.
We've done that through our job shadowing program. We've had them shadowing with Victoria. So we're looking at hoping to have a volunteer this summer.
Wonderful. And
So-
speaking of job shadowing, that's, although we touched briefly on it, but job shadowing happens a lot for when they're looking at a career, or maybe they're in school for a certain career and they
Absolutely.
need some hours to.
Right, and I work with physical therapy, occupational therapy, radiology. We have had a pharmacy student. So any of those areas, also our surgery department, in the job shadowing. These students come in and will do a minimum of 20 hours of just observing.
Okay.
There's no hands-on, unfortunately,
Sure,
for
but-
them, but they're able to observe, find out if this is truly the career they're looking at. I love to tell the story about a young man that came to me a year ago that thought he wanted to be a pharmacy tech, kind of a little bit of a science nerd, and loved his numbers and thought pharmacy was where he wanted to be. Found out after a few hours back in pharmacy that it really wasn't what he thought it would be.
Oh.
So I arranged for him to spend a few hours in radiology and a few hours in physical therapy. And he's now at ASU studying physical therapy.
Awesome.
So
What
yeah.
a great success story and a good way to end the program.
Perfect.
Perfect timing. Thank you for being on the show. And again, Leana, your phone number, 692-4673.
Correct.
So people can call if they've got more questions.
Exactly.
All right. Thanks again for being on the program. I hope you learned something, and call Leana. We could use your help. I'll see you next week with another great guest.